Welcome to the Youth Advisory Council interview series. We, the Youth Advisory Council at the Center for Youth with Bipolar Disorder, or CYBD, at CAMH, have started this series to try to raise awareness and translate knowledge from the ongoing bipolar disorder research in a way that's accessible and meaningful to patients and families. This is the third interview in the series. CYBD's Youth Advisory Council, or the YAC, was established in 2021 and is composed of 6 youth advisors with bipolar disorder. The YAC team allows the opportunity to meaningfully engage with our patients and integrate their voices towards education, stigma reduction, and advocacy efforts in the field of youth with bipolar disorder. A great accomplishment of the YAC has been the creation of Never Alone, a Youth's Guide to Bipolar Disorder, which is an informative and inspirational booklet that shares firsthand narratives of youth with bipolar disorder written by youth for youth. This series is an extension of the YAC team's efforts. Today we have 3 youth advisors interviewing one of the CYBD researchers. I'm Amelia, and this is my first term on the Youth Advisory Committee. I'm at Concordia for Aerospace Engineering, and I work in Dock Martens.
Hello, my name is Adam, and this is my second term on the Youth Advisory Committee. I work in fitness, nutrition from both a research and a practical perspective, and I'm going to school to Western to be a dietitian.
Hi, my name is Sunny, and this is my first term on the Youth Advisory Committee. I am a returning high school student, and I work at my family's Wood Fire Pizza restaurant.
So today we have Dr. Alysha Sultan here, who is a scientific associate at CYBD. She's here to talk to us about her research. Thank you so much for coming, Alysha.
Thanks so much for having me. I'm really excited to be here.
So Alysha, what is your current role at CYBD? What does that entail, and how long have you been here for?
Yeah, so my current role, I am considered a scientific associate. I've been working at CYBD for approximately 7 years. So I started as a PhD student, and then after I graduated, I moved on to a postdoc, and that has landed me in my current role as a scientific associate. So my role is really research heavy. So I help to mentor and supervise incoming grad students. I also help to run and set up our research studies. I help to gather data. I analyze the data, write scientific manuscripts, and I also help to oversee a lot of the lab-related tasks. So some of our research devices, as well as some of our biological samples.
Cool.
Awesome. Thank you
This
so
is
much.
real deal.
So could you give us a brief background on your education, work background, and how you got here?
Yeah, for sure. So I started my education at Wilfrid Laurier University in Waterloo. I did a Bachelor of Science in Psychology, and that is where my love and my interest of research really started. So in my first and second years, I volunteered in a research lab, just helping other PhD students with their research. And then in my last year of my undergrad degree, I did an honors thesis. And there I worked in a lab working with rats, so it was a wet lab. And I looked at the effects of THC on attention and inhibitory control. So that's really where my interest of the effects of cannabis use came in. However, I very quickly learned that I was more interested in working with humans rather than with rats.
What?
So then I decided to look into some programs after undergrad, research programs, and that's where I came across a program at U of T called Pharmacology and Toxicology. And also within that program, I was looking at labs that were available for me to work in, and I came across Dr. Goldstein's lab, so the Center for Youth Bipolar Disorder. And so I applied for both of those programs. I emailed Dr. Goldstein, I had some interviews, and that's how I got into my PhD program at U of T. So then once I met with Dr. Goldstein, I talked about how I was interested in cannabis use, and he didn't have anyone else studying that. So that's where my topic of cannabis use in youth with bipolar disorder came about, and how I ended up where I am today.
Okay. So your body of work is mainly focused on cannabis? That's what it's mainly focused on?
Yes.
How did you decide to pursue this topic of research?
Yeah, that's a great question. So as I mentioned, my love for research and the effects of cannabis use started in my undergrad. And so what my research really focuses on is in my PhD, I looked at the neurostructural and neurofunctional correlates of cannabis use in youth with bipolar disorder. So essentially that's looking at like brain structure, brain function, and cognition. So things like attention, inhibitory control, working memory, those kind of aspects. So that's where my PhD started. And then in my postdoc, I went into looking at some more genetic stuff. So we looked at something called a polygenic risk score, and how the genetics of cannabis use and use with bipolar disorder. And now I'm sort of following that subject and looking at some of the epidemiology of cannabis use. So that's like the occurrence or the distribution of cannabis use within this population. So really, I look at a bunch of different aspects, but the main core of my research focuses on cannabis use and use with bipolar disorder.
So we'd love to hear some more about that research, and we were hoping you could break it down for us to make it a little bit more understandable. So we're talking about now your paper on neurostructural correlates of cannabis use in adolescent bipolar disorder. So could you please give us a brief synopsis of the paper and make it accessible for someone like a middle school student?
Yeah, for sure. So for this paper, what we looked at was brain structure in youth with and without bipolar disorder. So measures of brain structure include volume, surface area, and thickness. And we looked at this topic in 3 different groups. So we had first youth with bipolar disorder and lifetime cannabis use. We had youth with bipolar disorder and no cannabis use. And then we had healthy control youth without cannabis use. And so we compared, we did 2 different methods in this study. We did something called a region of interest analysis. So what that means is it's a hypothesis-driven approach. So you look at the previous literature that's out there based on bipolar disorder and cannabis use disorder. And we picked specific brain regions that we wanted to focus on and look at if there was brain structure differences within these groups. Our second approach was a whole brain data-driven approach. So this isn't hypothesis-driven, it's just totally based on the data. And the data essentially tells us which regions of the brain are different in terms of brain structure in these 3 groups. So in the end, what we ended up finding was that surface area and volume in parietal regions of the brain. So the parietal region of your brain is sort of at like the back top here. It's responsible for like sensory perception and integration. And we found that so surface area and volume in the parietal regions were larger in the youth with bipolar disorder with cannabis use versus both the other 2 groups. So versus the healthy control group and the bipolar youth without cannabis use. And additionally, we also found that there was smaller thickness in frontal regions of the brain. So the frontal regions of the brain are just up at the top of your head here, and they're responsible for things like memory, emotions, impulsivity. And we found that so thickness in frontal regions of the brain were smaller in youth with bipolar disorder with cannabis use, again, versus both of the 2 other groups. So the youth with bipolar disorder and no cannabis use, and the healthy control group. So we did find opposing directions of findings in different regions and different brain metrics. So the reason why, or how we sort of explain this, is that different brain regions and different brain metrics, so like volume, surface area, and thickness, are differentially affected by genetics and the environment. So our literature has shown us that surface area and volume in the parietal lobe is more influenced by the environment, whereas thickness in the frontal lobe is more influenced by genetics. So although this is a cross-sectional study, so we can't draw any causal conclusions from this study, meaning we can't say, well, this was a cause or an effect of cannabis. Based on the role that genetics and environment plays in these different brain regions and these different brain metrics, we do think that the finding of larger surface area and volume in the parietal lobe is more a reflection of the effects of cannabis on the brain directly, whereas the finding of the smaller thickness in frontal regions is more of a reflection of a genetic predisposition to cannabis use. So overall, just to sum it up, we did find differences in brain structure in youth with bipolar disorder with cannabis use versus the 2 other groups, which are healthy control use and youth with bipolar disorder and cannabis use.
Okay, cool. That was definitely a lot.
Very informational. I was on the edge
of
of my seat. I was like, tell me more. Like, I have so many questions.
It's very insightful, very interesting.
Yeah.
Very fascinating.
So the parietal was bigger in people with bipolar who were using cannabis. Is bigger better? Why is that not a great thing?
That's a good question. So we can't say because this is just a cross-sectional study, just at one point in time, we can't say whether bigger is better or smaller is better. We can speculate based on previous literature that is out there, whether which way is good or bad. But yeah, because this is a cross-sectional study, we can't say one is bad and one is good. We just know that they are different.
Okay.
Then the assumption on the frontal lobe is that if you have a genetic predisposition to a smaller frontal lobe, maybe not as good at making decisions or impulse control, then you may be more likely to consume cannabis, especially as an adolescent.
Exactly. Yeah, that's exactly my thought.
And so you mentioned cannabis use disorder a lot in paper. How is that exactly like defined? Like I'm not sure. So I'm sure it'd be interesting to know.
So cannabis use is common and not necessarily always problematic, but when cannabis use does become problematic is when a cannabis use disorder is given.
Okay.
So for example, if an individual uses more than they intend to use, if they lose control of their use, leading to dangerous situations, or it creates problems with their friends or family, or if they their cannabis use interferes with their responsibilities at school, work, or home, that's when you start to enter the realm of an addiction or a cannabis use disorder. So in general, if cannabis use leads to significant impairment or like distress in their daily life, that's when they would receive a cannabis use disorder diagnosis.
Okay. Would you say that with what you saw on the brain imaging, would that come about with just more, not regular cannabis use, but occasional cannabis use? Or is it more with like, you have a disorder, this is what's going to come about? What do you think there?
Yeah, that's a good question. So in that paper that I was previously discussing, we didn't parse out those with cannabis use disorder versus cannabis use.
Okay.
So the youth with bipolar disorder that had lifetime cannabis use were all bunched in. So they could have used once or twice, or they could have met full criteria for cannabis use disorder. So it does seem for that paper it's across the range of use. And also I have some other papers that are just clinically focused, and we looked at like clinical variables relating youth with bipolar disorder and cannabis use, with bipolar disorder and cannabis use disorder. So we did separate those out.
Okay.
And then youth with bipolar disorder and no use. And there were significant differences between those groups in these clinical variables. So like, increased police contact, increased suicidality, more co-recurring disorders. So there was differences between all three groups, and specifically between the cannabis use disorder group and the cannabis use group, there was a bit more similarities than with the no cannabis use group. So it does seem that these problems do persist across the spectrum of
There's a
use and
spectrum.
aren't just for cannabis use disorder.
Okay. Furthermore, does age matter? Is age going to play a factor in this, and is it less important as you get older?
So age definitely plays an important factor in this. So during adolescence or during your youth, your brain is really at risk, where it's very malleable to outside factors, because your brain is in such an important developmental period or maturation period that any outside environmental factor really does play a significant role in changing that development or maturation or altering it or anything like that. So definitely the younger you are, the more at risk you are at the negative effects or associations of cannabis use. But that's not to say that as you do mature and as your brain matures and you get older, that you're still not at risk for some negative effects of cannabis.
And can there be any positive effects of cannabis use? Sometimes, you think of when you use alcohol and you're in a group of people, and so perhaps there's a social aspect of that. Are the risks of cannabis use different for youth with bipolar disorder or without bipolar disorder?
Yeah, so and when we're talking about recreational cannabis use, more oftentimes than not, the cannabis is high in THC and low in CBD. So THC is the main psychoactive component of cannabis, which is responsible for the high sensation that most people associate with smoking weed or using cannabis. So when we're talking about recreational cannabis use, there's a lot of literature and there's a lot of papers out there that have shown that there's majority negative effects. So those that are using cannabis, they have longer symptom duration, increased number of symptoms, more co-occurring disorders, increased suicidality, increased police contact, as I mentioned. So overall, for recreational use, which most often is high THC and low CBD, as I mentioned, the effects are not positive. In terms of those used with bipolar disorder using cannabis versus not, So youth with bipolar disorder do have increased rates of cannabis use compared to those youth without bipolar disorder. And specifically, youth with bipolar disorder have approximately 30% of them approximately have a substance use disorder, with cannabis use disorder being most common. And in addition to them having higher rates of cannabis use, youth with bipolar disorder also have a higher likelihood of progressing from cannabis use to a more severe cannabis use disorder. So overall, the risks of cannabis use are definitely, or the rates and the risks of cannabis use are definitely different for youth with bipolar disorder versus without.
So it's probably not great for any youth, but especially for youth with bipolar disorder, it can be extra potentially dangerous.
Exactly, yeah.
Would you say there are positive effects on users of cannabis with high CBD and low to no THC? Is that when you would say there are potential positive effects coming in?
So there's not a lot of research out there that has looked at just the effects of CBD specifically on youth with bipolar disorder.
Okay.
So there are some other
Little
literature.
niche.
Yeah, exactly. And so we know that youth with bipolar disorder are different than a lot of other youth or just adults, especially. So it's hard for us to say whether there would be any positive effects decisively from just CBD. But given that most oftentimes recreational use, especially from youth, is mixed with THC and CBD, we would say that it's best to just avoid it and not use it. Yeah.
Got it.
Okay, so if a youth with bipolar disorder has a cannabis use disorder, what would be the best practical first steps in order for them to get help?
So if they have just cannabis use, the first line of action would just be for their parents or peers to advise them to stop using. And then you would try to follow up with educating them about the medical harms associated with substance use or cannabis use in general. If it develops to a more severe cannabis use disorder, there are many well-studied and well-known psychosocial treatments for cannabis use disorder. Two of the most commonly known ones are cognitive behavioral therapy and family-focused therapy. So cognitive behavioral therapy focuses on identifying and modifying thoughts, behaviors, and beliefs that lead to problematic cannabis use. And then family-focused therapy essentially helps to reduce familial hostility and criticism by working on problem-solving skills and communication. So those are two of the main psychosocial treatments. In terms of pharmacological treatments, there's only been one study that has looked at lithium in youth with bipolar disorder, but substance use disorder in general, so not specific to cannabis use disorder. And there's only been one other study that has looked at N-acetylcysteine in youth with a cannabis use disorder, but not specifically youth with bipolar disorder. Both of the studies did find improvements in cannabis use disorders over time, but we do definitely need more research on specifically youth with bipolar disorder and cannabis use disorder to see not only what pharmacological treatments are best, but also which ones pair best with psychosocial treatments.
So how do you think this is going to be practically relevant for patients now, in the future? And do you think the findings can be applied to their lives?
Yeah, so I think these findings are really applicable to the lives of these youth because essentially it's directly giving evidence-based information, whether the effects of cannabis, or not the effects because they're cross-sectional studies, but whether the associations of cannabis use are positive or negative. So with the legalization in 2018, we have seen a significant increase or decrease in the perceptions of harms, but increase in cannabis availability. So with that, the thinking is that it has led to more people using or more people trying cannabis. And with the lack of information that's out there, people aren't making adequate decisions on whether it's beneficial or not for them. So the hope is that with this research, we're able to help these individuals to make more informed decisions on whether this is best or not for them. And with what we have been finding so far, we would say that we would hope that they would deter from using cannabis.
It's tough because you look in Toronto and on every corner there's a cannabis shop that's trying to promote it to you and all the potential benefits.
And all the new flavors they have to
Yeah.
bring you in.
Yeah. So.
Yeah.
And from this research, is there anything, is this something you want to continue researching? Did any future questions arise? I mean, one thing I am interested in, we mentioned, was CBD as well. That's marketed, but some people say it could be beneficial. Is that anything along those lines that you're interested in?
Yeah, so there is based on the research that I've done, many questions have arisen, and also just the lack of literature that's out there. There's so many questions that I would like to look at, follow up with. So as you mentioned, looking at just CBD and parsing out, the components of cannabis, seeing if one is worse than the other, one is better than the other, vice versa. That would be very interesting. Also looking at long-term, like longitudinal repeated measure studies would be really interesting, because being able to follow people over time and looking at the effects over time would help us to be able to better understand the cause and effect relationship of cannabis. So whether like cannabis is causing these problems, or whether these problems are an effect of cannabis, so whether it's cause or effect. We don't know the direction, so repeated measures, longitudinal studies would help with that. We'd also like to look at studies with looking at potency and frequency of cannabis use, so like how much individuals are using, how often they're using, because again, that also can play a big role in the effects or the associations of cannabis use. And lastly, I think genetics would be something also that would be really interesting to look at, to see if, gathering this clinical information, this biological information, this genetic information, for maybe one day able to develop like a risk calculator for cannabis use disorder or for cannabis use, and use that to help better treat or prevent cannabis use disorders and youth bipolar disorder in the future.
I have a question. I'm not really sure if this hints any bases, but have you, with cannabis use disorder, I'm sure there's symptoms. Are they the same with youth with bipolar and regular youth? Like, is that something you've seen before? Like, do they have similar symptoms, or are they different, worse?
Yeah, so to receive a cannabis use disorder, whether you have a diagnosis, whether you have bipolar disorder or not, the criteria is the same.
Okay.
So yeah, it has to be
It'll
essentially
show the same.
interfering with their life, causing problems, interfering with them being able to do things. So yeah, the symptoms are like the same.
Okay.
So how do you believe this upcoming research will reduce stigma and improve the lives of those affected with bipolar disorder?
So we hope that this research would provide evidence-based information to be able to help dispel myths and reduce stigma surrounding mental health issues. We also hope that this research would be able to inform public policy or clinical practice to be able to help guide, as I mentioned, future prevention or treatment strategies. So overall, by raising awareness and providing education to those who use with bipolar disorder, we hope that this empowers them to make more informed decisions and be able to advocate for themselves, ultimately improving their lives, decreasing stigma, and fostering a more compassionate and supportive environment.
Awesome. That's great. I can't wait. Let's do
Yes.
that. So why do you think it's important to have youth with lived experience in the research process?
Yeah, so,
Or I'm not saying why do you think, I don't know if you think it is. Do you think it's important?
oh yes, I think
Okay.
it's very important, very,
Awesome.
very important. I think, giving a voice to people that this matters the most to is the most important thing. And you're also getting firsthand feedback on whether they think this would be helpful for their lives, or if they have any personal insights that would help to better the research and be able to make what we do and our research more applicable to those that we're actually trying to help and make a difference with. I think it also brings a sense of community. So, other people's lived experience that are looking at this don't feel alone. They can see people that they can relate to. It fosters like more of a community, and it makes people feel not alone. And it also sort of opens up the world of research to people that might not have otherwise been interested in it. So if they see someone else that has the same mental health issues as them, they might be more willing to, oh, they did it, so I can go participate. And in the end, it's like full circle. They're helping us, and so we can try to help them.
I totally agree with that. And I feel like we all have that experience with the YAC Council as well, like a sense of community, and people who have the same experience as us. And Sunny and I have even had conversations where we're like, wow, oh my God, so similar experience. So it feels great to have that community.
Yeah, so clearly, working with youth is rewarding, and I'm glad that we can have some input, and hopefully, we talk all the time, and so. Is there anything else that's been particularly rewarding for you doing this research, and maybe through the dissemination process? I don't know if you've gotten there yet, or presentations, or meeting different people in the area.
Yeah, I think one of the most rewarding things is being able to interact with youth with lived experience and being able to see firsthand, a lot of research is behind the scenes, like on the computer analyzing things, writing papers. It's nice to see the work that you're doing is actually going towards helping people.
Yeah.
And it's so that would be like the first rewarding thing for me. I think something else is also like knowledge dissemination at the end of gathering data, analyzing it, writing a paper, going back and forth with authors and co-authors, and being able to see the end product of a paper come out of all that work is also something that's really rewarding.
For sure.
So, in your experience, how has the cooperative and team-oriented nature of the lab at the CYBD enhanced your research and its impact on youth and their families?
So I think that the team-oriented nature of CYBD is the most important aspect of our research. I think without everyone having their hands on deck or working together, none of this would be able to be possible. To be able to get studies up and running, the youth, when they come in, they see one person that's running that visit, but they don't realize all the hands on deck that it took to get that research started. Like bringing to the ethics board, doing protocols, like buying the devices, training, all of that stuff. So without everyone on the team and everyone working together, we wouldn't be able to have such a great research environment and an environment for kids with bipolar disorder. So I think that team-oriented nature of CYBD is really important, and I'm really thankful to be part of the team.
Takes a village.
Yes.
So for young researchers or students, someone my age interested in pursuing a career in mental health research, would you give them any advice?
Yeah, so if you wanted to pursue a career in mental health research, I think one of the most important things is to get involved as much as you can and as early as you can. As soon as you have that interest spark in your mind, I would reach out to labs or people that you're interested in working with, see if you can volunteer, get involved, oversee what they do on a day-to-day basis, just to get your feet wet and see what a real day in the life of a researcher or doing research is really like.
Yeah.
And I think this is one way to not only, make connections and to build up your name and your resume, but also to get a feel for what you do like, what you don't like. You might have thought you liked something and then you actually try it and you don't really like it, or vice versa. You might have not thought you did like something and you really like it. So I think that's my first piece of advice. And then once you're in this field of research, I think another piece of advice is persistence. Persistence is key. You might write grants and not always get them. You might try to submit papers to journals and get rejected. So I think you have to sort of have tough skin in that, but when you know your work is sound and good and will make a difference, you have to be persistent and
it'll
stick with
come.
it. Yeah.
That's great. That's great advice.
Is there anything else you would like to share about your upcoming projects at CYBD?
Yeah, so I don't have anything specific, but what I would like to share is that we have a lot of ongoing research at CYBD. We have a lot of current ongoing research studies, and we hope to in the future have even more. So if anyone's interested in participating in research or getting more information, to reach out to one of us or to go to our website to learn more.
Awesome.
So, thank you so much for your time. We've learned a lot, and we know our audience will find this insightful and appreciate it.
Yeah, this was great. Thank you so
Thank
much.
you so much.
Thank you.
Thank you so much
Alysha.
for having me. This was great.
Thank you.